Hello viewers, welcome back to my channel. We are going to discuss an important cause of male infertility, azoospermia condition. Azoospermia means absence of spermatozoa in the seminal fluid. The causes for this azoospermia are broadly classified into two, non-obstructive and obstructive causes. Non-obstructive causes are genetic disorder, hormonal disorder or hormonal imbalances, varicocele, systemic diseases such as diabetes mellitus, hypertension or any psychiatric condition, and the medicines taken for the endocrine disorders, undeveloped or underdeveloped genitalia, exposure to radiation, and the lifestyle factors such as addiction to alcohol, smoking and all. So how homeopathic medicines are going to be useful and helpful in getting back the count in the seminal fluid is what we are going to discuss in this video. For the foremost cause, genetic disorder, Klinefelter syndrome or Y chromosome deletion. In such genetic condition, there is no homeopathy medicines or any medicines to treat this condition, and we cannot get back or resume the semen in the seminal fluid. Under hormonal imbalances, any hormone defect due to glandular dysfunction or impairment in the glandular functions could be corrected with the help of well-selected individualized homeopathic medicines. Homeopathy medicines may be useful to correct the glandular functions, and the imbalanced hormones are coming under control or balanced to get the sperm production and also finding the count in the seminal fluid. And the next cause is the varicocele. Abnormal enlargement of the veins inside the testis may be causing abnormal heat and leading to death of the sperms produced. Similarly, systemic diseases such as diabetes mellitus, hypertension or any endocrine disorders may be a cause for azoospermic condition. How the diseases are causes? Similarly, the medicines taken to treat such diseases also may be the cause for the absence of sperms in the seminal fluid. So for these conditions, we can diagnose on the basis of the investigation, and also the causes of such clinical conditions should be identified. By removing the cause with the help of well-selected homeopathy medicines, we can find the sperm count in the seminal fluid again. Underdeveloped or undeveloped testis also would be the cause. For this, we have wonderful medicines such as Aurum metallicum, Calcarea carb. So these medicines will be helpful for treating this small testis or undescended testis also. We can find the seminal count if it is taken in the right way. And exposure to radiation such as X-rays, mobile radiation and solar rays also would be the cause for azoospermia. For this, we have X-rays as homeopathy medicine, mobile radiation homeopathy medicine, and solar rays also can be used homeopathically to treat this cause and eradicate this ill effect of the radiation, and we can find the semen count again in the seminal fluid. And the last one is the environmental factors such as if a person becoming addicted to smoking or alcohol consumption or any drug habit, this may lead to absence of sperm in the semen. So to take away the craving for the smoking or tobacco chewing or becoming addiction, the mind of the person could be treated on the basis of the mental generals taken while taking the homeopathic case taking. So individualized medicines will be helpful to take away their craving for this abnormal toxic objects. Thereby we can resume the seminal count in the fluid. Similarly, for hormonal disorders or the varicocele, we are having well-selected medicines such as pulsatilla, acidum hydrofluoricum, clematis, lycopodium may be useful to treat the varicocele also. So even if the varicocele is grade 3 to grade 4, we can treat this without any surgical intervention. We can get back the testis into the normal condition and we can get the count also. Likewise, the non-obstructive causes how we have treated, we discussed. Now the obstructive causes such as any growth, polyps, cyst may remain as an obstruction in the path of the semen. So this may lead to azoospermic condition. Whether the cyst may be calcified or non-calcified cyst, well-selected medicines, example Tribulus terrestris, parathyroidinum, Calcarea floor, Silesia may be helpful to treat this calcification and removing the obstacles in the path of the semen. Similarly, infections in the male genitalia such as epididymal infection or infections in the testes causing orchitis also could be treated with the help of pulsatilla, acidum hydrofluoricum, clematis, sulfonamide, belladonna, ferrampas. And another obstructive cause is retrograde ejaculation. The semen which is coming out will not be found in the seminal fluid. Instead, it is reversing and getting back into the bladder. This is called retrograde ejaculation. For this obstruction also, we are having wonderful remedies like Thuja metallicum, thiocinaminum, Silesia, acidum nitricum. These medicines are useful to treat this retrograde ejaculation, and we could find the semen in the semen analysis. The next one is under obstructive causes. Any previous surgeries like vasectomy or surgeries conducted for hernia, this may lead to scar formation in the male genitalia or in the path where the seminal fluid is coming. So this scar may remain as an obstacle and preventing the semen presence in the seminal fluid. So this could be treated with the help of the medicines thiocinaminum, Silesia, Calcarea floor, Calendula, Ferrampas. So these medicines will be helping us to treat this complications of the surgery, and even the scar tissues could be turned into normal tissues and remove the obstruction. Likewise, cystic fibrosis is another condition. So the thick viscous fluid secreted under this clinical condition may remain as an obstacle for the semen. So this also could be treated with the help of well selected medicines on the basis of individualization. In addition, pulsatilla, arsenicum album will be helpful to treat this cystic fibrosis condition and remove the obstructive cause in the azoospermic condition. And the last one under obstructive causes, absence of seminal vesicle and seminal ducts. If there is no organ, it cannot be treated, and for this obstructive cause, we could not find any homeopathy medicine, and it remains as a limiting factor under our homeopathy system. If the organs are there and the abnormalities in the organs could be corrected or treated with the help of medicines. In the case of absence of organ, homeopathy medicines will have no rule and we cannot treat this cause also. Similarly, tumors and polyps in the path of male genitalia also may remain as an obstructive cause. For this, we can select on the basis of the type of the tumor and the infections in the tumor. We can treat with the help of Calcarea sulph, Myristica sebifera, Calcarea carbonicum, Phytolacca. So with the help of such medicines, we can treat the polyps or the tumors which are remaining as an obstacle in the seminal path. Hope this video will be helpful for you, how the homeopathy medicines are helpful in treating the both obstructive and non-obstructive causes of azoospermia.